Welcome to the Ambulance Specialty Care Transport webinar. I'm Tom Ryan with Provider Outreach and Education, and I'll be your presenter today. Today, I'm joined by Karen Curtis from my team, who's going to help as my technical assistant, but also helping me with the chat and monitoring, keeping track of all the questions you place in there. Today, we will take questions in the chat. We will get to those as time permits. I did take some pre-submitted questions. Those of you that did the registration, you'll be familiar with those. So we will want to get through all of those different types of information. I wanted to let you know that this webinar is in response to your questions that you've asked during other ambulance education, also to the surveys and the other ambulance supplier information you've asked for. So you asked for this, hopefully I can get you what you need. One of the best ways to do that, though, was to make sure you ask those questions in advance, and I'm going to recommend that for any future education you register for. If you have a specific need, let us help you. Ask the question in advance. Don't say, hey, we'll ask it on the webinar. Let us give us time to research, do all those different things. And I will tell you that I did have some people who put some questions in there that say, hey, I'm going to ask the questions on the webinar. Well, I can't be prepared and help you out, especially if I have to give you a cited source or reference. So we want to make sure you're aware of that. Let's talk a little bit about what we're going to have to do today. So again, this education is a tool to assist providers. I will let you know that the basic starting point for SCT hasn't changed at all, but that was one of the first questions we asked. But it could change, and CMS can change at any given point. Anyone who's worked with Medicare for a period of time knows that Medicare changes, the rules, the regulations, all of those types of things can change. Now, again, when I say the basis of SCT, that's the same. We're going to keep up with that information as we go through. I did take questions in advance. I will give you the best that I can, and I really would encourage you to answer those questions, offer additional items in the chat, do any of that type of thing to help me understand what you're looking for. Some of the questions I got are really not answerable, so again, I'll give you the best I can based on what you asked me. Also, CMS prohibits the recording of this presentation for profit-making purposes. We cannot ensure how you're going to use this presentation, so we ask that you don't record, screen print, or do any other form of information gathering like that. On the other hand, what we will do is actually record it. That's why I did start the recording. Once it's started, I will post this as an encore presentation, and it will be available to you. Keep in mind, you will be given the opportunity to rate me on a survey, and we'd really like you to do that. The encore presentation will also give you an opportunity to do that. So you'll have the opportunity, if someone missed it or you want to give additional feedback, to take that survey. So based on what we know, here is what I am going to talk about. Now, again, what I know is that you asked for certain things, and so we wanted to talk about those in just certain categories. So I chose 3 basic information categories. My goal is to get you the information on Medicare Specialty Care Transport, or SCT ambulance benefit. This information is applicable to those people in jurisdiction 5 and 8. Much of the information is a national benefit or national basis because it is coming from the national references from CMS. However, not every piece of information will be, and there's going to be some stuff that I'll talk about specifically from our website, wpsgha.com. That would only be applicable to our providers. The reason that I mention that is I do have people from different contractors who registered for this event and who may be joining us. So we want to make sure that they're aware that not everything may come to them. So what are we going to talk about? Well, we're going to start off with some coverage criteria. We're going to talk about some documentation criteria, and then I definitely want to give you some resources. I will let you know that we are not currently reviewing SCTs or specialty care transports. That procedure code is not currently under review with WPS. So when I say we, I mean WPS. In this case, though, other medical review contractors are looking at it. I've gotten a couple examples from them. However, I was not able to get the documentation that went with it. So I'll give you some verbal examples, kind of what was explained to me as best I can during the process and the course. All right. So let's talk about the coverage criteria. This is the basic understanding. What I'd like to do is actually give you some basic resources to start with. And again, as I go through, I will talk about some of these different things. I will show them to you at the end, so I'll talk about them, but I may not show them to you. Okay. So the first question we actually got was, can you define for me what qualifies as an SAT, what meets this criteria. And the actual answer is this is defined by CMS and the Medicare Benefit Policy Manual, Chapter 10, Section 30.1.1. It does leave some interpretation, and I'll get into that in just a few moments. So here is what the Medicare Benefit Policy Manual says. And you can see that references right here on the bottom. If you want to open it, go ahead and select Chapter 10. By selecting it, it'll blue out for you, and then it'll actually bring the link right to you. I did have people ask me specifically if I gave them this link or if they could look it up. It is right here. If I scroll through, you'll see that the different references are available to you. And in particular, this is Chapter 10, 30.1.1, okay, which is ground ambulance services, but it's under the definition section. And that's where I'm going to start. And then I just scroll through, I can find SAT in here. I'm not going to necessarily read it to you, but I just wanted you to understand where I got it from, how CMS then defines it. If you want to use Control F, you can do that as well. And it will find the reference for you. This is where I'm getting this information. Now, again, I will show you some of those other things again, but this is just a starting point, and we did have a couple of questions based on this information. So I want to make sure you're aware of where I got it from. So what's our key things? First of all, SCT has to be a ground transport. It is considered the highest level. Now, CMS uses the term specialty care transport, or SCT, as the highest level of ground transport. I'm going to use that term because that's what CMS uses. A few people have said, well, my state calls it a critical care transport. That's fine. That's a reference to your state, giving it the same thing, giving it the same name. It's just are giving it a different name for the same type of transport. And sometimes that will happen. You'll actually hear someone talk about that. So when we're talking about SCT, remember, it is the highest level of ground transport. Okay? We'll talk about coding and information a little bit later. CMS does say it must be interfacility, and we'll talk more about that in just a few moments. And again, I'm going to talk more about each component. They do have to be a critically ill or injured patient. So to define this is actually defined by the medical professional, and a basic definition that we got was, or that we use, is a serious state in which an ill or injured individual has dangerously unstable or abnormal vital signs and typically requires short-term life support measures. This could be mechanical respiration, defibrillation, something like that, for stabilization and support prior or during recovery. So that's a very general definition, and each medical professional does look at that a little differently. Also, someone asked, can this be affected by a person's medical training, how they use that? And the answer is absolutely. So this is why an EMT must evaluate the patient and actually look at what the medical professional is telling them and whether they agree with it or disagree with it or all the different items that go with it to make a specialty care transport. We'll talk more about that as we get into this. Also, the patient does have to require continual ongoing care. That's part of the basic benefit package here. So just because they're on oxygen, does that automatically make it a specialty care transport? And the answer is no, but it also doesn't make it medically necessary either. People have oxygen all of the time. They travel with portable oxygen equipment. They travel with machines that produce this. So again, to address that question, no, just because they're on something like oxygen does not make it a specialty care transport, doesn't make it anything like that. Now, if you say they're on oxygen because they have this, this, and this, and therefore we're going to have a respiratory therapist on board because ... Okay, now you've entered into a lot more of a scenario and you've given me more information, and because of that, my answer would be different. So I wanted to make you aware that and use that question as an example of how I'm going to answer questions throughout. All right. I will say again, go back to that chapter 10. These are your basic key points, but we do want to break it down further. This is what you asked me to do. So let's get started with that break. Oops. So ground transport. This means it has to be by a state licensed ambulance and emergency medical technician. A couple people commented that your state does not say a paramedic is an emergency medical technician. I will let you know that CMS does define an emergency medical technician to include a paramedic. They actually give 3 levels. So your state may not call them an emergency medical technician. They may say paramedic or even something different, but they do have to be state licensed at the highest level available. Then it has to be medically necessary ground transport. In other words, this is the only safe means that the patient could be transported by. This is your basic ambulance benefit. It doesn't really change because it is a specialty care transport. However, the medical necessity does drive the level of payment, and we'll talk more about that, along with the state licensure and the services being provided. So there's some different kind of key items that go into that. When we look at a ground payment, it always will incorporate the base rate, which will include your supplies and services. This is the professional service, the ambulance payment, all of that. It does offer a separate mileage rate, okay? Separate mileage rate. So you're looking at a base rate A0434 and a mileage rate of A0425. Each one will be considered with specialty care transport so long as it's medically necessary. Okay. The next criteria set forth by CMS is that it has to be an interfacility transport. CMS does have very strict definitions of what is considered interfacility. It says a hospital. Now, a hospital could be anything that they define as a hospital. Critical access hospital would be an example. It's a small community hospital versus a larger hospital. So a hospital doesn't just mean, hey, it's the acute care hospital that I know down the road. It is defined as a hospital. A facility will also qualify as a Medicare participating skilled nursing facility. This is key there because if it's not a Medicare participating facility, they do have different requirements and each state can license them for Medicaid, but they may not have the same requirements as Medicare. That's why they use the term Medicare participating facilities. Hospital-based facility, meaning Medicare's hospital-based status requirements. This is one that we use to incorporate all other portions of the hospital, maybe an off-campus area, something like that, that would be part of a hospital. So they use hospital-based as that terminology. So the patient cannot be inpatient in a facility. If they're inpatient, that falls under the hospital bundling rules. And that's actually from the Medicare Benefit Policy Manual as well. And that's Chapter 10, Section 10.3.3. So if they're actually admitted and you are doing a transport, that is billed back to the hospital. It is not separately billable as a specialty care transport. So we want to make sure we're meeting that criteria. They have to be done on when the patient is outpatient. Doesn't mean they couldn't be leaving something like an emergency room or observation care. Those are both outpatient statuses, okay? Other things that were asked that would go into kind of meeting these definitions, skilled nursing facility. Remember, yes, a skilled nursing facility consolidated billing would apply to this, should it not be to a hospital or critical access hospital. Except in most cases, SATs are to that, and that's the whole principle of an SAT. That's why when you're billing at this high level emergency care, again, the highest level Medicare offers for emergency transport, you want to make sure you're aware of that. So should you be applicable to skilled nursing facility consolidated billing? The answer is no, probably not, but I can't guarantee that without knowing the procedure code's billed. Next question about interfacility. Is an SAT to the hospital considered? Well, that's a hard one to answer because where are they coming from? If they're not coming from another facility, then no, that SAT would not. We'll get more into that one. So what facility or what hospital could they be admitted to? And the answer is we use the same criteria we would for any other thing. They have to have the beds, staff, and equipment. This is why sometimes leaving a facility's ER hospital and moving to something with higher level of care is an SCT transport. So there's a variety of factors that play. It's not just, hey, it's a hospital in general. We have to look at all the other items. We'll talk more about a couple of different things in general, but I do want to address one question right away. Medicare, somebody asked if an SCT can be considered round trip, and the answer is no. An SCT is one-way trip to and from one facility to another. A round trip implies it's inpatient already. Therefore, if they're inpatient, that's the only time Medicare would consider round trip and again would not be separately billable. Let's move on to the care requirements. So the care requirement states that first, it has to be at the level of an emergency medical technician, EMT, paramedic, EMTP, within their state scope of practice. So this one is established by the state licensure. What is your basic licensure meeting? This is good for you guys in that it is, again, going to vary by state, and it's going to allow you to work within your state. Someone said we actually have a local criteria which is more strict than our state. Then you need to follow that local criteria, not the state licensure. And I wanted to point that out because I know it says state license on here, but you want to follow that. So it then goes on to state, okay, here's your basic criteria. Now, if your state licensure or your local licensure says with additional training, they can do the inserts, that's when an SAT may become a possibility, because it's not just part of what a paramedic has to do. It's, hey, here's the extra stuff they could do if they meet these criteria. Now, if you're questioning this, it is your job to prove this. So we ourselves don't typically question this. We don't typically look at this in our medical review process. Why? Well, we're not looking at SAT at this point. But could another reviewer? Sure, they could. Let me give you an example. There's a recovery audit, contractor audit, where they could be looking at this to making sure you're meeting all these criteria. The Office of Inspector General has an active work plan where they could look at it. So you want to make sure that you're meeting this. And it is your job to show them, here's my state licensure, here's what the additional training was, and yes, my paramedic passed that additional training and is ready to do this, okay? So again, it has to be an EMT. The next question is, does it have to be the EMT who performs the service? And the answer is no, not always. Sometimes we do load specialized providers or professionals on, and these specializations will qualify for an EMT as long as it's medically necessary, needed, and meets all the other criteria. I listed some of those examples here. So emergency or critical care nursing, one example of this was from a burn unit, and they had to have a certain type of care given during that time. And so that's where the emergency or critical care, emergency medicine, respiratory care. Again, same thing, that same burn unit, they actually had to have a respiratory therapist on due to the patient's smoke inhalation and trying to keep them stable during the transport. So there's a variety of different factors that will play into that. Now, again, the paramedic may do the evaluation, but so may the person who is actually the professional loaded on. So yes, it is a paramedic, and yes, they could do this with additional training. On the other hand, we could also have certain medical professionals, and here's a list of them, some of them, not all encompassing, of course, but here's a list of some examples for you. What would still qualify? The next one seemed to be a big question that we got, and this is the documentation criteria. So we'll get into this because it was a lot of questions. I've tried to answer some of those questions and kind of move them together a little bit. So the first one, is there special documentation requirements for an SCT and what's exactly needed within the chart? I want to let you know that the base documentation requirements must still be met. There isn't a quote unquote special documentation requirement. It is to prove the level of care required and the fact that it is medically necessary. So when you're looking at your requirement, what makes this care above the scope of a regular EMT, paramedic level, and what is the additional training that would be needed? Also, does your rig, does your actual ambulance have the supplies and the items needed to support that? Or did you have to load them on maybe at the hospital or maybe from a different facility? Whatever the situation is, we want those in there. So it's not different than the regular documentation requirements. It's only that sometimes it's a bit more because you have to prove that it was medically necessary at that level. So the basic documentation requirements will remain the same. What type of information should you always make sure? Well, start with your ambulance supplier information. Make sure you've got your patient information, your signatures, your date and time, your assessment, your transport reason, your action logs, and then anything that you may need in addition to that. A couple people did say, do I need a physician certification statement? I will talk about that a little bit, and we'll get into that a little bit more. And and we'll answer a question on it at the end, but I wanted to let you know that that would be part of this area. So no, there's no special documentation requirements. However, it is going to need to support the level of care and the patient's need for that level of care, along with the fact that you have all of the care equipment and items available. That's what we're really looking for. Let's go through these documentation criteria a little bit separate. All right, so first of all, patient's information. All of us are pretty familiar with this one, and so we want to make sure that the patient's information is available. Start with their name, their date of birth, their sex code, the Medicare beneficiary identifier, if they have a primary insurance or a primary payer. Now, this is important regarding an accident or anything like that, so you want to make sure you're doing all that, and a signature. Okay, when you're gathering this information, does it have to be done at the time of transport? And the answer is no, it has to be done before billing. So it's an emergency situation, the patient's unable to talk, you don't know all of this information, you still have to gather it before you bill Medicare. You still have to ask the patient for this information. Otherwise, how would you even know to bill Medicare, right? Because part of that is the Medicare beneficiary identifier, which is the patient's Medicare number. So you want to make sure you're getting what you can. Other times you can gather it from certain sources. So in an SCT situation, could you gather some of this information and start with it from the hospital or the facility you pick them up at? And the answer is absolutely. So make sure we're aware of that. But you still need to gather the patient's information. And that is in response to a question, what patient's information needs to be gathered before the transport? And the answer is, again, you need to gather this before billing if the transport is urgent or emergent. What else do you need? I have to have a medical necessity. I have to have something that's going to help me with this. So this is where we're going to talk about what proves medical necessity for Medicare will always be an assessment done by the care provider. So a lot of people say to me, is it the assessment by the emergency medical technician, the EMT? And the answer is yes. Here's a couple of things you need to be aware of. Is an EMT basic allowed to do an assessment? Absolutely. Is it allowed alone to prove that an SCT is needed? No. Now, on the other hand, let's say that you're going to have an RN board, and the RN is going to do monitoring, the RN is going to do a variety of other things, and because there's no paramedic available, or you're going to have a respiratory therapist board. Now, that was the situation I gave you with smoke inhalation one. And they said, well, the EMT did a basic assessment, but really the respiratory therapist is the one doing the assessment to say, yes, I need to make sure this qualifies. Yes, that person can assess the patient and use that assessment to help prove that an that an SCT is qualified. So we want to make sure that we're aware of it. So if we don't have someone at that level, or for whatever reason that paramedic, that assessment isn't being used, but instead we're using this assessment from this person, and that person's going to board and treat the patient, or is going to pass that information on to the paramedic, and then that paramedic's going to use that information to treat the patient, yes, that is still going to be a valid assessment. Hopefully that makes sense when we say patient assessment. One of the other questions is, does the assessment always support the same as the reason for transport? No. How many of you guys get a dispatch and you get a reason, you get there and the EMT, whatever level, basic, intermediate, paramedic, assesses the patient and you're like, these don't make sense together? And even though they came from a skilled nursing facility or something like that that would qualify, you're like, it doesn't work. So yes, we always recommend a reason for transport versus the assessment reason, and you want to keep those together. Someone did ask me about some additional documentation as related to this. So I've already talked about the patient assessment and who can do that, but let's talk about the physician certification statement. So is a physician certification statement alone going to prove the assessment? No, it's not. It's the person that's actually treating that patient who will do the assessment. So again, if a paramedic is not on board and you're going to have a basic level of transport be done, but you're going to have this done with an ambulance that is fully equipped and is certified to do this, but you're going to use a nurse or a respiratory therapist, their assessment is what proves it, their medical skills, okay? The physician certification statement just indicates that it is something the physician feels should be at that level and why. it does give you a basic starting point or some understanding for what the assessment is. The same thing with a facility discharge report. And that comes in, a lot of people say, well, I have an ER report that gives me this, it gives me this, it tells me these things. That's a great point to start with your assessment and say, here's what I know. But if you have either a physician certification statement or a facility discharge report and you don't use it for anything, you can't count it. It doesn't mean anything, right? Because how did you use that in the patient's care? So hopefully that makes sense to everyone with how we want to make sure we're using those correctly and why they cannot stand alone. The assessment of the care provider is key to make sure. And part of that assessment can be done by a non-EMT if that person is going to remain with them and going to help throughout the care process. All right, so let's talk about facility reports a bit more. I do recommend that you always include the leaving facility's communication to the treating EMT or professional. Here's what we recommend. If they give you a verbal report, write that into your assessment or into your run report. You knew that information, therefore you were able to use that to support medical necessity. If you don't know the information, obviously not. Um, Also, when you're doing that, tell us how you used that information. Did it drive your assessment? Did it drive how you treated them? Was there a certain aspect given that said, okay, this is what the doctor's ordering, this is what we want you to do? That can be given verbally or in writing. It doesn't make a difference there, but we will have to have it documented. Without that documentation, we don't have it supporting the medical need. So we want to make sure it's part of the medical record, the run report, whatever you want to call that, we want to make sure it's part of that for sure. Okay. So that's how we use facility reports. Now, again, does it have to be necessarily a discharge summary? No. Does it have to be a physician certification statement? No. It could actually be a verbal report given by an RN or given by a respiratory therapist or given by a medical professional treating that person from the facility. So I want to make that as clear as possible. It doesn't necessarily need to be in writing, but you do need to somehow have that documented in order to understand so that Medicare, should they need to, can understand how you're using that. All right. Transports, your basic transport documentation does need to be met. For those of you that don't know what the basic transport documentation is, it's your point of pickup and your point of drop off. We need addresses. Point of pickup, always make sure you have a zip code, at least a 5-digit zip code. We say that because it does drive part of the payment factor. Drop off is exactly what it sounds like. It's an address. We need it to be a street address. Please don't tell me you drop them off at a PO box. We've gotten that a couple times, and I've always wondered how you fit that patient, that care provider, and the next set who you're transferring the care to into that PO box. So drop off has to be a street address. What is the street address? Mileage, again, you want to document the en-route mileage. If you just put mileage and it's a given number, we're going to assume that, but we can use mapping software and other verification systems. So when you look at mileage, tell us what's going on. And I can give you an example from an SCT that occurred. A patient was transported due to a car accident, but because of the car accident, the way in which would have been most direct to the facility was blocked. So, okay, they get transported to this ER. Now they have to go to another facility because of complications. There's no way. It's going to be an SCT. They do have them stable, but it's still their condition. When they go to transport them back, the roads that they needed that would have given them the most direct route were not available because of the car accident they were originally in. They had some other things going on, so they had to document why they went around. So mileage is important, and the documentation of that mileage or additional mileage is also important. Who's the treating EMT or professional? Tell us who they are, but also give us their credentials. Was it a respiratory therapist? Was it the EMT paramedic? Help us understand that. Please don't just give us a name. And what happens with that is when you give us a name and you give us a name alone, we don't always know who that is, and we don't know what that person's qualifications are. So you may have more than one Tom Ryan as an example, and that person could also then not meet the criteria in one case, but in another case they could. So when you give us their name, that's why we say they're medical professional as well. Also, if it's someone that's working with you or getting on board to help you or doing some of the assessment, make sure that that person is included. Also, transports for higher level of care are important, and a lot of times with SCT, that's what we see. Specialty care transports are for a higher level of care, more than what a nursing home could offer, more than what an emergency room at this facility could offer, or this facility doesn't have this available. So help us understand what that higher level of care is that they're missing. And we want to make sure we have a full picture. Okay. Additional information that Medicare will consider, we want to know if you know this. So if you happen to know it, great. Sometimes you're going to get this from the facility they leave. Other times it could be from a bystander. But just things to consider, including medications if known. We also always recommend if there's an allergy of some sort that could affect what you're doing. This sometimes is really key for helping us understand why you're monitoring a patient. What is the reaction? What is the drug reaction? Did we not know? Now maybe that allergy has complicated the situation, which now affects that other issue that was going on. So now we have an even bigger issue. So we always recommend that. If you do happen to know family history or social history, I would recommend including those. Again, very key to make sure that you're getting all of those basic pieces of information inside there. All right, so that's my documentation. Next, we'll move through some resources. The first one I already mentioned, and I think I might have showed this one to you, but this is Chapter 10 in the Medicare Benefit Policy Manual. Now, this one is very key because this is the overall services. So if you're not familiar with Chapter 10, I've given you a variety of links, but I do want to move you through this one and just show you how to find these this manual and the next one. Go ahead and move to the CMS website. On there, go to Medicare. And when you come in, you're looking for regulations and guidance. A lot of people ask if this is under coverage, and the answer is no. It's under regulations and guidance, and then manuals. Once you're in manuals, on the left side, internet-only manuals. If you want to think of it anyway, think of the internet-only manuals. This is your day-to-day operating instructions issued by CMS, the Center for Medicare and Medicaid Services, to both you, the provider, and us, the contractor that processes the claims. So it's really important that you know where this stuff is. If you go down, each manual has a publication number and a title. Medicare Benefit Policy Manual is 100-02. Let's go ahead and select that. And as I scroll down, you can see there's a lot of different chapters. What we're really looking at is Chapter 10 in this case. What's great about this is it does lay out a lot of the information that I've already gone through. It gives us the basic benefits, both for ambulance just in general, but also SCT and specialty care transport. It's all within here. So you want to make sure that you're following those key pieces of information. So someone asked me if air ambulance can be specialty care transport, and the answer is no. Air ambulance is a separate benefit from ground. And as defined within the benefit policy manual, ground ambulance is for SCT is for ground ambulance. Only air transport, you will use your air transport codes differently. So air ambulance, two different coding, different sets of rules. Now, along with this benefit policy manual, which gives you a lot of information and a ton of different things that we need to go on here, I would also recommend, and I'm going to back up just a couple of times, that you scroll down to 100-04, which is the Medicare Claims Processing Manual. Again, publication 100-04. This is your next slide. What's important about is within Chapter 15, very specific for ambulance. I just want to show this to you as well. What's going to give you all the different pieces of information is how we as a contractor are required by CMS to code things, to do things, and to enter edits and audits into the system. So again, not just specialty care transport, but overall. And this is where I got like the zip code requirement that I talked about, making sure it's documented. So you want to make sure that you're following all of these requirements as well. Sometimes this is just great information and you're like, didn't really help me with that claim that I needed or that information that I needed, but it is also good to understand how we will process your claim. And that's what this will do. Okay. The next slide for you is going to talk about a documentation requirements article. This documentation requirements article is actually something that WPS put together to help ambulance providers in general. So that means it's not on the CMS processing center. So before I go to that, I did want to let you know that I want to talk about one more thing on this area here on cms.gov. I'm going to go to Medicare for just a moment. And if you look through Medicare, you'll see a variety of different types of information. Some people are interested in this and some people are not. If I go to coverage, you can see a breakdown. I also always recommend that you search. And this is how I find it easiest to find this particular resource. And I'm just going to search for ambulance. Now by doing that, there we go. You'll see the first item is an ambulance service center. Yes, you can locate this by navigation. I just find it way easier to search for ambulance. When I go to the service center, CMS has put a lot of information for ambulance providers into this particular page. It's really nice that it has a lot of links. It'll take you to a lot of places, including to both of those IOM references, but it also references in this case, here's the Code of Federal Regulation reference and information you'll need to know. So how do you find all of these different pieces? This is where you're going to come out. It's a great resource, but there's so much in here. I can't even go through all the information that would be in here for you because there's just so much. But it is also where our fee schedule is located, and that's right here. Okay. Public use files, reasonable charge, this is all related to the fee schedule. So hopefully that helps you understand where we get our information when we're talking about education and where I get my information from. Now, let's leave this site and we're going to go to the WPS site, WPSGHA.com. We are in the middle of a redesign, which is what the MET for up on top. I'm not sure if you can see that. The public side, or the side that we're going to look at the articles on, is done. The secure section, which is right here where you would log in, this is what's currently being worked on. So one part's done, one part's not, which is why we have a temporary MED in front, just so you're aware. What happens here is there's under the top. I'm just going to open that up and you can go to different items. Let's start with documentation first. If you want the general documentation requirements that I gave you and a variety of other things, go ahead and look at all of this information. I do think ambulance, in my opinion, I like the specialty service category, just me, but it is going to be sorted by topic. If I come in, I automatically know I have two items. One is the physician's ordering ambulance service checklist, helps you with a PCS if you want it. But the bigger one is this ambulance document requirements article. And it actually talks about all kinds of things related to ambulance documentation that were put together by our medical review team in support with other medical review contractors to help you understand what you need. So it's really important that you go through this. When you look at SET, you have to meet all the general requirements as well as the medical necessity requirement. And the medical necessity requirement is the one component that says it has to be above the EMTP. So that's what we have to be able to prove, what skills were needed above that level of basic licensure. And this will vary by state and area the service is performed in. Okay. So that's going to help you a little bit. There's also another one out here, which some people like and some people don't. So it's up to you if you want to use it. But we're going to leave there. We're going to go to claims and we're going to move on to the next slide. I do like this article a lot myself, but I like it because I go to specialty and service and I go to ambulance. I open it up and there is a decision tree, which will help you if you want to make a choice. But the statutory and billing requirements article is great. It's going to give you a lot of information, a lot of very clear, concise, what are we looking for, especially if you're wondering about a hospital or a skilled nursing facility and some of those ambulance modifier, destination and origin modifiers and how we define those and which ones to use. That's where we're looking at that. So we want to make sure you're well aware of where to find this as well. Okay. And again, it does give you, someone asked me specifically what the procedure code is. It's going to be an A0, and I just got to scroll through it. There it is. A0434 is our ground SCT code, and A0425 is our ambulance mileage ground code. So those are the two that you would use, okay? This is part of the key making sure that when you go to bill the A04, that A0434, you meet the medical professional requirement as well. You want to make sure that that's available. Yes, they can do the assessment if an EMTP is not available and they're going to be part of that care. So they have to be licensed at or above an EMTP. One other thing I did want to show you is I'm going to jump back to the CMS website. I'm going to item here. I'm going to do a search, and what I'm going to do is show you this rack audit. I met it, and I thought, well, this is probably a pretty good opportunity for you guys to see this, for those of you that don't know. So this is the approved rack topics. Now, the rack is the recovery audit contractor. They're another documentation contractor. Okay. So we can do, I don't know if it'll come up with SCT. Let's see. Otherwise, we may need to do a search in a different manner. Okay. Nope. Let's do so ambulance is its own category underneath here. So let's just do ambulance along with ambulance on lab and see what it pulls. And if you scroll through, you'll see the full list of this. Now, there is one that is very specific. And there it is, specialty care transport. And so this will then help you understand if you're looking for what the recovery audit contractor is doing, who is the #1 reviewer of these right now. It is recovery audit contractor. This is approved. This is in all AVMAC jurisdictions. This is an audit that began in 2020 and continues to this date. So there's the codes that we're looking at. We already talked about that. Here's some references. Great place if you want to start with some references. Really will help you understand a lot about some of the different references. Along with that, we were asked, where will this be posted, which is what the next slide is all about. It's the ambulance playlist on the YouTube channel. So I did make a recording of this. We will post it. So let's take a look at that. If you're not familiar, we do have a YouTube play channel. It's called WPS GHA. You can search for that, open the channel. Once you're there, I do recommend going to the playlist. And inside the playlist, you can search for the ambulance playlist or the encore playlist. I'm going to tell you I prefer to search for the ambulance one. My reason for that is that the encore playlist has on it, and it's about 400 or so long, so it's pretty long. The ambulance supply one is much shorter. It does not have as many videos, but it does have everything applicable. This will be in there as well. Okay. So just to give you an example of what the playlist looks like and all the different things you'll find out in there. All right, I'm going to come back to the slide deck and we're going to jump through some different stuff because we went through all of these different resources just one at a time. So let's talk about some questions you guys, let's talk about some questions you guys submitted, and then I'm going to take live questions should we have any. So this is your opportunity to put them in that chat feature. But here's your chance for what you've already submitted that I haven't answered yet. So I want to make sure we get through these. The opposite of what we've talked about so far is what does not qualify as a specialty care transporter, SCT. And the key thing to remember is it does not qualify if it is not above the basic level of an EMTP. And that again is state or local licensure that we're looking at. Or is there another medical professional on board that would be above that? So an RN, a respiratory therapist, a CRNA, whatever the situation is, right? Is there something else that would have to be there? So that's what we're looking for. So if it does not meet those base criteria, it will not qualify for an SCT. Next part of that question was, it's not an interfacility transport, it's to a type of transport. Now, my assumption with this would be that they're taking them from a facility maybe to an airport, and then maybe from an airport to another facility after the air transport. That does not qualify as interfacility. Nowhere on that list does Medicare say, except for sited transport. So we still have a question pending to CMS, and it's been pending for quite a long time, as to how they would like us to handle those. Do they want us to use the facility to facility? What are they looking for with that? And we'll have to wait until they come back with more information to give you a different answer. But as of right now, based on when they say interfacility, they are saying directly from one to another, and each leg of the transport must be considered alone. Therefore, a site of transfer doesn't qualify. So hopefully that makes sense to you guys. Next question, does the run report need to indicate that a specialist is on board or just the procedure code was done? Please indicate the specialist that's on board, especially when it's a specialist, because the specialist would not be the paramedic. Now, we still wanted to indicate the paramedic. Don't get me wrong. If the paramedic's in on board, yes, we want to know that. But if there's a specialist, whatever that specialist is, yes, you want to indicate that on the run report. You want to indicate their name. You want to indicate their specialty. You want to indicate their medical credentials. That's part of proving that you did the SCT transport, because that's part of the level of care requirement. If you just have a basic, you have 2 EMT basics and there's no other indication and you bill an SCT, that will not meet the SAT criteria. It doesn't. And if you try to send in more information after the fact, after you find out all of this, it could be looked upon in terms of fraud and abuse and open some other complications. So indicate it up front, make sure everything is there. If you find that it has, I'll give you an example, like something's missing and you haven't been requested for anything, you're just doing a documentation review, or your coder says, hey, I don't know what you mean by this, go ahead and do a late entry. We're okay with that. Yep, but as long as it's noted, we're good. So when we look at that, is there a way in which the documentation should be completed for that staff member? And the answer is no. We do want their name, which would be first and last name, legible, please. That means if they sign and you can't read it, that's not going to help us. You can print their name below it. You can do a variety of other things. We also want to make sure that their specialty is available, because we need to know that that specialist is on board, whatever the information is. So if they were to just say Tom at or Tom RN, that's not going to help me. I need first, last name plus RN, and then maybe even, are they yours? They your nurse as the facility, or is there more to it than that? So what facility did they come from? Why were they getting on board? All of that type of thing. So we want to make sure there's as much as we can get from that name, because just a first name doesn't always help us if we have to track back. Again, we're not doing that right now. That's just what we're being told by the other contractor. So hopefully that makes sense. I can add more if you need more. Let's see. How to use the WPS website more efficiently? I'm not really sure what you were looking for there. So if you could add some more information in chat, I can probably help you with that. I would recommend making sure you're familiar with the topic centers. I would recommend listening to some of our on-demand trainings, which are our YouTube encores. They will help you out with that. Does SCT recognize transports for doctor's appointments from patients' home? No, we don't do that. A doctor's appointment would typically be done at a physician's office, and that's not a covered destination. It is only an emergency destination. And very rarely could it ever be, or will never be at an SCT level, because you're not going inter-facility, because you mentioned that it's coming from a patient's home. Next question was, how do we bill an SCT? Well, again, you do have to have the documentation to support it. You want to bill the A0434 with your base rate. Your base rate will incorporate your supplies, your provider or your actual professional who performed the service, all of those types of things, and the rig. And then you also get to bill the A0425, which is your ground ambulance mileage code, and that would be a separate code. So the follow-up question was, does Medicare have a specific diagnosis code requirement? And the answer is no, we don't have a specific diagnosis code requirement. The claim can contain the signs and symptoms, but it could also contain a diagnosis code from the departing facility. Either one is fine. Do medics have to do the SCT transport? Now, I've answered this a couple of different times. Medics, I'm assuming paramedics. And the answer is yes. If you're going to use an EMT, then they have to be at the paramedic level, but they have to have that additional training. On the other hand, could it be someone trained, such as a respiratory therapist or some other medical professional? And the answer is yes, so long as they're doing the actual care and they're documenting that. So you want to make sure all of that information is good. Hopefully that's what you're getting there. What makes the run a true SAT over a non-emergent care? Well, first of all, it's the level of care needed for that patient. It is an emergent care. SCT is automatically emergent. Now, if you're telling me it's non-emergent and that patient is stable, yes, they may have a chronic condition. Yes, they may have, but it's still not necessarily an emergency to get them there. Then that would be a non-emergent. It could be a BLS or an ALS, depending on the other things. SCT is critical care, right? It has to be done right now. That's part of the definition. So because of that, that's what we're looking for. Hopefully that makes sense to everybody with that question. So other than ventilating, can you give some examples of necessary service supplies as beyond the scope of a paramedic for ambulance billing? Now, this is a really hard one in general, and the reason that it's hard is because each area, again, state licensure will drive this. So I can give you some general examples based on things that we've seen, and these are two basic ones that we've gotten. Now, I did not get the documentation, or I would love to have shared that with you. I just have some scenarios. So one of the ones was a recent burn victim, and I did talk about this. The burn victim was transported and stabilized. They did have smoke inhalation. They also had third-degree burns. While the patient was stable, they were still critical. Also, the sterilization and oxygen needed to be controlled. I'm not really sure what they meant by that because I don't have the medical record. It's just a general statement. So what made this the SCT was, first, breathing difficulties and the fact that they had to have a respiratory therapist on board. They did not have an EMT paramedic on board. They did have an EMT intermediate, which is fine, but the respiratory therapist was on board due to the breathing difficulties and other problems. This was not someone who could wait and be transported once they were 100% stable, because this facility did not have the need they needed for the lungs and the burning inside the lungs and the other problems. So they needed to move them now in order to be life-saving. Critically ill or critically injured, in this case, critically injured. So hopefully that gives you one example. The second one I have was a patient who was having coronary issues. I don't know exactly what the coronary issues were. They did not specify. They did say this was following a heart attack. So the facility that they were at was able to treat them, get them stable, but they were not able to do all of the complications due to whatever the situation was. There was monitoring and other things that were needed. The EMT paramedic was able to treat them with additional training, and that had something to do with the equipment that needed to do for the monitoring and also for some of the medications that had to be specially administered. That's what I have for information for you on that, but that was another example, okay? So when we look at that, that's what we're looking for. So next question, how can a coder tell the patient is critically ill or injured in the eyes of an insurance auditor? This seems to be very subjective. We understand that this is subjective. We have heard this many times. The best way that you can do this is to look at the information provided in the documentation. Follow the information I've given you. One, the medical professional telling you that it is critically ill or injured. That is also subjective in that their medical training may differ, and depending on the school they went to, it can actually be a different definition. So we gave you a very generic one. There is no surefire way to ensure this. What we do have to look at also is the training level and what is available, okay? So remember that when we look at certain items and different things, we have to look at the available training in that area as defined by that state regulation. So though it may not be applicable to you, it might be applicable to someone else in a different area. I talked about that when they talked about one of the states that has a specific locality. In other words, a city has more restrictive, or that specific zip code has more restrictive than the state does. That's what we're talking about. So I do want to open it up at this point and see if we have any questions. Karen, do we have any questions?
We have gotten a couple questions, Tom. The first one is from Catherine, and she'd just like a little clarification. She says if there are two EMTB as the crew and an RN that is monitoring an EKG for transportation due to the service having no available paramedic to monitor the patient transport, this does not qualify as SCT, correct? And she says the confusion is in the level of care the RN would be given that isn't outside the scope of a paramedic? And if they had a paramedic available for the transport, they wouldn't need the RN.
Yeah, she's actually correct on that. So remember that because that's within the scope of a regular EMT, their level of training and their qualifications, their state licensure would qualify them, and it sounds like in her case it would. Now, I will quid pro quo that if it would be somehow without that training and in your state or local licensure does not allow an EMT paramedic to do that, then it would or potentially could be. But if you're just putting them on because the paramedic's not available, no, you don't get the additional upper charge to the SAT. That's not how it works because it's still within that scope of a paramedic just because they're not available at that moment. Next question.
Okay, the other question we received, sorry, what if respiratory therapist is not with your ambulance company? Can we bill then? Or
Um,
can,
so, sure, I get it. I get what you're asking, and I want to throw something out to you guys. And let me use a reference here, which is why I'm talking a little bit. I want to come back to this particular reference, and I want to show you where we're going to get that answer from. So, do you have to employ them? And the answer is yes, in some way. Now, does that mean they have to be a direct employee? No. Could they also then be someone who's temporarily employed? Absolutely. Could you pay them for that one-time transport while they're on board? Absolutely. So when we look at the Medicare claims processing manual, 100.04, remember, we're going to talk about some general billing information for ambulance. So again, ambulance specific, chapter 15, right in the opening paragraph. I'm wait, sorry, it delayed and then I scrolled. So when we talk about this, it will talk about payment rules for ambulance services to critical access. I'm trying to find where it says it. You have to have a charge essentially. Without a charge or without a fee for it, um, it's basically going to tell us in this area that you're not allowed to bill for it. So we want to make sure that when we look at this, again, I was not prepared quite for this one, so I will apologize for that. It basically says if you don't have a bill, if we can't pay you for it. So that's why it could be something that is one-time owned or one-time done. So it's only for payments that you have a charge or an expense for. And it's either going to be in the opening paragraph of 100 dash, could be 100-02. Again, researching this as I go, because I wasn't quite prepared to answer that question in that manner. Let's check chapter 10 and see. It is in one of those two, and I apologize that I don't have it right off the top of my head. Let's see. Certain service classified paid for the ambulance under Part B. Also, payment may be made in for expenses incurred. There it is. Sorry, it is 100-02. It's in the basic benefit manual, and it says payment may only be made for expenses incurred for ambulance services provided. So this means that you have to have some. Now, keep in mind, you don't have to employ them all the time. You don't have to do any of that. You do want to make sure that you are paying them for that time or you're reimbursing that respiratory therapist in some way. So hopefully that makes sense to everyone. I will say that that is all the time that I do have for questions. If there's more questions, we will get those back to you in email. Again, it did take me a little bit of time to come up with that reference in 100-02, but it is there for you. All right, well, that brings me to the end. I do want to thank you for listening. I would encourage you to provide the feedback. It does help us overall improve. It really helps me understand whether I met your needs today. Remember, I do want the good, the bad, and all of it in between. Also on that survey, if you would include any other topics you want, we do consider these. This was actually driven based on that and then the questions you were asking during some of the other webinars. So it's very important that you do that. Please take time to review our live events page and our encore for additional training coming from us. On behalf of myself, Karen, Provider Outreach and Education, and all of WPS, thanks for participating. We look forward to your survey comments, and we hope that you'll join us again in the future for more education.